Today we're going to assess your TMJ and your cervical spine. There are some cardinal signs and symptoms I want you to look out for, and to please notify me if you are experiencing any of these.
Okay.
Great. Then we're going to start with a postural assessment with your feet flat on the ground and your back as straight as possible. From the front, I'm just looking at the symmetry of the eyes and the ears. Her symmetry looks good to me from the front. If anything, her right ear may be a little bit higher. That would be indicative of a head tilt, which means she might have tight lateral neck flexors. So next we're gonna go to the sagittal view. We're gonna be looking for the earlobe to be going straight through her acromion process. And then also her chin, is it level or is it tilted any? And from the sagittal view, she looks great. And from the back, I'm again checking for that symmetry of the ears. Again, noted maybe a little bit higher here on the right. The head does not seem to be rotated to either side. To move on to active range of motion. And we're gonna start with Atlanta occipital flexion and extension. So I'm standing at her side and I would like you to nod your head as if you're kind of timid about saying yes. And then on the down part of the nod, make a double chin slightly. And here I'm just looking for that she has about 15 degrees range of motion. She looks good to go. So the next test we're gonna do is Atlanta occipital rotation. I'm gonna be in front of her and then ask her to take her left ear to her left shoulder as much as you can. And then once you're there, can you look up towards the heavens? Great, and that's about 35 to 40 range of motion. And then for the other side, so take your right ear to your right shoulder and then keeping that bend, look up towards the heavens. And that side looks a little bit more limited. And now we are going to move on to the temporomandibular joint. So again, I am in front of you and I'm gonna ask you to depress or open your jaw as wide as you can. In that position, can you have your fingers going this way and stick them as many as you can inside of your mouth? She did get to her proximal interphalangeal joint of 3 fingers. That's the norm, and that is about 40 to 50 millimeters. So now we're going to do lateral deviation. So can you grunt, yes, and then move your lower jaw completely to one side. And I'm looking for the mid, and you can go back and forth. I'm looking for the midline of her bottom jaw to go to the central incisor of her upper jaw. And she did a great job. That is a normal range of motion, about 10 to 12 millimeters. Now we're going to do mandibular protrusion and retrusion. With your bottom jaw, protrude it forward and then also backwards. Great. And all I was looking for there was that the teeth did clear the top row of teeth. And now I'm going to palpate your TMJ to assess for any types of movement problems. So I'm going to feel for the lateral pulls of your mandibular condyles, and can you open and close? And I'm going to assess again for the quality and quantity of movement. Keep going, please. And I do not hear any crackling or feel any popping. And so in the early phase of your TMJ opening, all rotation, it's a posterior roll with a slight anterior glide. And then in the late phase of opening, that mandibular condyle to glide anteriorly past the articular eminence. Brilliant. Now we are going to move on to ligament testing. So I'm going to be at the patient's side and I'm going to do the sharp purser test, which is sagittal plane stability. I begin by palpating her spinous process of C2, and then I take my other hand and I place it on her forehead. I put her into a slight flexion, and then I move her occiput posteriorly on the atlas. Was there any pain there whatsoever? Nope. The next test is the tectoral membrane test, and that is for longitudinal stability. So this is a continuation of the posterior longitudinal ligament. And I'm gonna start by depressing her shoulders with my forearms and holding her occiput and her head in both of my hands. And then I'm gonna provide a light traction up and a gentle passive flexion. Did you experience any of those cardinal signs or symptoms that I mentioned?
No.
Great. So now we're going to be in supine, and the first of these ligaments is the alar ligament test. This ligament runs from the dens to the atlas, and it restricts side bending and rotation to the opposite side. So first we're going to test the horizontal plane stability. I'm going to palpate C2, spinous process on the left. And then with my other hand, I'm going to rotate her cervical spine to the right and feel for that to pop into my finger on the left. And here I do feel the spinous process pop into my left finger. And this would be the sign of an intact left alar ligament. Now I'm gonna switch hands and palpate the spinous process of C2 with my right hand and rotate her head to the left. Here I do feel the spinous process pop into my left fingers. And this would be the right alar ligament that I just tested. This ligament also provides stability in the frontal plane. So I'm gonna do the same palpation of spinous process of C2. My left fingers are on her spinous process, and I'm gonna take her into a right side bend. And it popped in about right there. And this would be the sign of an intact left alar ligament. And then I'm going to switch hands and palpate the spinous process with my right hand and rotate her. Oh, and it popped in a little bit earlier there. And be the right alar ligament that I just tested. So the alar ligament does also provide stability in the frontal plane. So with my left fingers, I'm feeling for the spinous process of C2, and then I'm going to move her into a right lateral side bend. And I feel it pop into my fingers about right there, and that is a sign of an intact left alar ligament. And now I'm gonna switch hands to test for the right alar ligament. Feeling for C2, spinous process, and then taking her into a left. And that side bend, actually, the spinous process popped into my hand a little bit earlier, but that would be testing her right alar ligament. The next ligament I'm going to test is the transverse cruciate ligament. This ligament provides stability in the sagittal plane. So I'm gonna palpate the transverse processes of C1. And then I'm gonna create a line with my fingers and push up slightly and hold here for 15 to 20 seconds. And this gentle lift up was a slight anterior glide of the transverse process of C1. So first, we're going to assess atlanto-occipital flexion and extension. I'm gonna hold the head with a hand on each side. I'm gonna place her in slight flexion at the OA joint, and then I'm gonna begin to just nod the head. In this motion, the flexion, there's an anterior roll and a posterior glide, and in the slight extension, there's a posterior roll and an anterior glide. And I'm assessing here just for a firm end feel. Next, I'm going to assess atlanto-occipital combined motion. So first, I'm going to bring her into that flexion again, and then I'm going to move her into a right side bend. And in this right side bend, there's coupled left rotation. Now I'm gonna bring her back to the middle and then go to a left side bend. It seems as if she was a little bit more limited in her left side bend than her right. For our second atlanto-occipital combined motion, I'm going to bring her into slight extension. And then I'm going to side bend her to the right. And then with this side bend, we have a coupled left rotation. Come back to middle, and then do a left side bend. And here we're going to have a coupled right rotation. And in extension, it seemed pretty even, her side bends. And for our last passive range of motion test, we're going to be doing atlanto-axial rotation. So again, I'm holding the head on either side, and then I bring her into a side bend with the mid-cervical spine. So now, I'm going to rotate the head to the left, and I'm getting a firm end feel. Now I'm going to side bend the mid-cervical spine to the left. Now I'm rotating her to the right,